Hello, everyone, and welcome to our What Matters to Her Facebook video series, where we discuss anything and everything under the umbrella of women's health and pregnancy. And today, we are going to discuss something that's very important for almost all women. Now, when a girl reaches puberty, period becomes a regular part of their life until they reach their menopause. And it's not always a regular, smooth flow. Sometimes the symptoms can be mild, and other times it can be sometimes painful or even something that is worrying that you need to seek medical help. And today we are going to delve into this topic. And as always, we are fortunate to have our very own Professor Probhodana Ranaweera joining us to explain on this topic. So let's see what question we have for him today. Doctor, could you please explain to us about spotting in between periods?
Right. Okay. So spotting after menstruation, in the sense like in between periods, right? So that can happen a few days later or in the mid-cycle, or so once you have your period, before the next period, any bleeding, because there are two types. There is something called intermenstrual bleeding, or it's in between periods there is a bleeding significant, or there can be spotting. So when this happen, right, so now that's something we take little seriously, because that's these two can be symptoms of cancer, especially the neck of the womb or cervical cancer, or even endometrial cancer. So we take it seriously, but majority of the time it's due to something else, nothing to do with the periods or cancer or anything, right? So we take it seriously, but if you have it, you should not get alarmed so much, but it's something needs to be checked, right? So so basically we divide into two categories: cancer or non-cancer, basically, or benign or malignant, we call it. So the benign lesions are there, something called polyps, cervical polyps, ectropions, where there is more estrogen stimulation of the neck of the womb, so the neck comes out, the thin layer comes out, and that causes bleeding. And there can be vaginal lesions like abnormal vessels, candidiasis, that is a fungal infection in the vagina, which attached to the vaginal wall, and when they falls out, there a little bit of bleeding, and which mix with the whitish material, and when it comes out, there's a blood stain. So these are the non-cancerous lesions or causes. And sometimes if you're taking blood thinning agent like warfarin and all that, that can also cause a problem. So these are the common things, and some of the skin conditions like eczema and things can cause bleeding or spotting in between periods. Now, as I told you, like the cervical cancer, so check for the pap smears, and even taking biopsy of the things may be needed depending on what we see at the neck of the womb. So that is something we are worried, and we need to check it. But as I told you, majority of the time, it's a benign condition.